Well, thank you so much for that warm welcome, everyone. Thank you, Carmen, for that kind introduction, and also for your leadership in this area and in so many other important areas that your office has been confronting over the years. I also want to thank Carmen in particular for her friendship over the years. As she mentioned, we served together on the Attorney General's Advisory Committee, and I came to know Carmen, and through the discussions we would have about the shared problems and concerns and frustrations of sitting U.S. attorneys, through her discussion of the cases, and more importantly, from her conversations about the people in her district, I learned how much she cares about these issues on a very, very personal and very, very deep level. And so, Carmen, I thank you for your leadership in this field. I know that Attorney General Maura Healey was here earlier. Again, another leader in this area, in this field. I want to thank also not only Attorney General Healey, but Commissioner Barrell for the steps that they've taken here in this state from this, as soon as they took office this year, to clamp down on opioid trafficking and abuse throughout Massachusetts. Massachusetts is often a bellwether for issues, trends, innovation. Sadly, it also deals with this issue of opioid abuse and addiction. But again, it has become a leader in the area. Dr. Dimitri, he's here, there he is. Dr. Dimitri, you and your colleagues at the Massachusetts Medical Society, you advance public health and safety. You are bringing attention and expertise to this critical issue, but I know that you all, as physicians, see the true human cost of this issue. And so behind this conference really are years and years of dedication and care and concern. So I thank you and your colleagues for that as well. And thanks to everyone for coming together to attend this summit. This is a summit that is so important because it really recognizes the vital public health issues in what far too many, for far too long, have only seen through the lens of law enforcement. Now, it's a real pleasure to be in Waltham this morning. There's nothing like autumn in New England. I miss it, I will say that. And it's a real privilege to join all of you, a distinguished group of public servants and public health experts, as we explore new strategies for curbing drug abuse and building stronger and safer communities. Because, of course, our communities are the supportive bedrock that will get us all through this. Now, it's particularly appropriate that we are here at the Massachusetts Medical Society, the oldest continually operating state medical organization in the United States. Congratulations to that. You've set the standard for your peers for over 2 centuries. You've attracted and united more than 25,000 physicians and medical students behind your essential mission of promoting the health, the benefit, and the welfare of the citizens of the Commonwealth. And you've also built a striking record of success in educating and advocating for Massachusetts medical professionals and the patients, particularly the patients for whom they care. And so I applaud you and thank you for leading such a truly comprehensive campaign to reduce prescription drug abuse in the Commonwealth. And I want all of you to know, here at the Society and beyond, that the Department of Justice, and in fact the entire Obama administration, is standing with you in this fight. Through the tireless efforts of our Drug Enforcement Administration, led by Acting Director Chuck Rosenberg, we're making major strides in all 4 of the action areas identified in the White House Prescription Drug Abuse Prevention Plan, which President Obama discussed in his weekly address just a few days ago. Yes, this is at that level of attention within the White House. And of course, those 4 points are enforcement, disposal, monitoring, and education. Now, on the enforcement front, we are using every civil, criminal, and administrative tool that we have to discover, to disrupt, and to dismantle illegal traffic in pharmaceutical controlled substances, and we are making real progress. We have targeted the illegal supply chain. We're thwarting doctor shopping attempts, and we have disrupted so-called pill mills. Just a few days ago, we won a conviction in a 49-count case against a former heart surgeon in Georgia who was aggressively prescribing controlled narcotics to patients who were already addicted to them. And at one point, this doctor was receiving and prescribing more oxycodone pills than any other doctor in the state of Georgia. Now, of course, further highlighting the often heartbreaking costs of addiction, the doctor himself was also addicted to painkillers. Now, we've also ramped up our focus on individuals and organizations who use the internet to buy and sell controlled substances. The internet's a wonderful tool for so many things, but we all know it's become the marketplace for illegal activity as well. And we've seen a marked reduction in online trafficking as a result of these efforts. And what's really important is we are building cooperation and communication between agencies that are tasked with combating this challenge. We do this by integrating DEA agents and investigators with other federal, state, and local law enforcement officers in 66 tactical diversion squads stationed across 41 states, Puerto Rico, and the District of Columbia, and we have 3 more on the way. Now, just this past May, our collaborative efforts, this approach, enabled us to execute the largest pharmaceutical-related takedown in DEA's history. It was a takedown of pill mills as well as of medical professionals who were illegally diverting prescription drugs, diverting them away from real patients and into the hands of street sellers. This operation spanned 4 states. It involved nearly 1,000 law enforcement officers, and it resulted in 280 arrests, including 22 doctors and pharmacists. Now, we also know, as you do, and as you are discussing today, that opioid addiction often begins not with a law-breaking doctor, but with a family medicine cabinet. This is the source of so much pain, as well as help for people. And that is why we are also working to ensure that the unused, unwanted, and expired medications are responsibly discarded and taken out of circulation. In the last 5 years, the DEA has held 10 National Take-Back Days, most recently this past Saturday. And that's, of course, when the public is encouraged to bring in their excess prescription drugs to literally thousands of designated sites across the country. There, they can be assured of safe and secure disposal of these unused, expired, and outdated drugs. And in the past 9 days, the past 9 times we've done this, DEA, in conjunction with state and local, and more importantly, tribal law enforcement, because we're looking to deal with this issue at that level as well. DEA has, over the years, collected nearly 5 million pounds of medication. That is 2,400 tons of medication that is no longer circulating throughout our communities, no longer sitting in the back of a medicine cabinet for a high school student to pick up, no longer sitting unused in a kitchen for a child to ingest out by accident and be harmed. And last year, the DEA has introduced new ways that we hope will make this even easier to dispose of old and unused prescription drugs, including many more authorized drop-off sites, as well as the prepaid return mail packages. And the goal is to make this program even more efficient and even more effective, thereby making all of our homes even safer. Now, aggressive enforcement, conscientious disposal, very, very important, just part of the picture. We're also continuing to support the prescription drug monitoring programs at the state level, because we recognize that rigorous monitoring is one of the best ways to detect and prevent the diversion of pharmaceuticals. 49 states and the District of 49 states and Guam currently have monitoring programs in place, and the District of Columbia has just authorized one. And we look forward to working with every jurisdiction going forward. And we're doing this through the Harold Rogers Prescription Drug Monitoring Grant Program. This will make these programs more robust and more effective. At the same time, yes, enforcement, disposal, we have those, we're working on those, but we are also amplifying our education and our outreach efforts to inform professional associations, the industry organizations, and law enforcement agencies at all levels about the latest developments and programs and policies affecting opioid trafficking and addiction. Now, just last year, FY 2014, the DEA conducted 150 such events, building on 114 the year before. In addition to monitoring, going beyond this important step, we are working to expand medication-assisted treatment for opioid use disorders. Medication-assisted treatment for opioid use disorders, the key to solving this. And we are placing additional focus on treatment for incarcerated individuals who've experienced issues with addiction to help ensure that they can return to their communities healthy, strong, productive members of society. Now, of course, this work has taken on special significance because, as we've all learned from scientific studies, and as many of you in this room have seen from your own practices, treatment providers, the victims and investigations have all shown us that prescription drug abuse is a common precursor to the abuse of heroin, an incredibly dangerous drug that is also experiencing increased use in recent years. We're calling it increased use in recent years. It is an epidemic. It is a tragedy, and it is a public health crisis. And that is why, since April, a multi-agency heroin task force has been meeting to design a comprehensive plan which will be delivered to Congress by year's end to counter the spread of heroin nationwide. Now, meanwhile, the Department of Justice Organized Crime Drug Enforcement Task Force has allocated additional funding to help address the surge of heroin overdoses in the New England region, including here in eastern Massachusetts. And the DEA recently led several major actions against drug cartels and heroin traffickers while raising awareness about a new problem with this crisis, the growing presence of fentanyl in heroin that is sold on the streets. Fentanyl substantially increases the risk of overdose to tragic effect. Now, of course, none of us can be there to stop every person from abusing heroin or prescription painkillers, much as we'd like to have that hand intervene. We can't be there at that moment, but those of us in law enforcement can take steps to ensure that we are prepared to respond when we do encounter heroin or prescription drug-related emergencies in the field. And that is why my predecessor, Attorney General Eric Holder, urged local law enforcement authorities to carry the drug naloxone. Now, naloxone, which you all know can help restore breathing after an overdose, has been key to saving lives. He encouraged local law enforcement to carry naloxone as a standard tool on their belts. He followed up last July, in July of 2014, by issuing a memorandum directing federal law enforcement agencies, DEA, ATF, FBI, our Marshal Services, directing our federal partners to assess whether their agents should also be trained and equipped to recognize and respond to opioid overdoses, in part by carrying naloxone. And since that time, our Bureau of Justice Assistance, an important component of the DOJ, has provided a law enforcement naloxone toolkit, which serves as an information clearinghouse to help law enforcement agencies establish their own naloxone programs. Now, this is an area that is going to sound so familiar to many of you in this room because it's an area in which Massachusetts has been a groundbreaking leader. And I want to thank you for that. Thank you for leading the way. Thank you for being an example. And I want to recognize all of you for your work in this issue, because those of you who have worked on this project have saved lives, and we thank you for it. Now, through all of these efforts, we at the Department of Justice are fighting diligently, creatively, and more importantly, collaboratively, with the partnership of individuals like all of you, each and every day, to ensure that our communities have the assistance, the resources, and the guidance that they need to bring wrongdoers to justice and to end this deadly crisis once and for all. Now, the work going forward will not be easy, but it is clear to me that from what we have already accomplished, that we actually have tremendous reasons for optimism. And if we can harness the expertise and the passion and the conviction that's assembled in this room and at this conference today, I have no doubts in what we can do. We can preserve opportunity. We can strengthen families. We can save lives. And after all, today's summit, this gathering of all of you who care, is not only about reversing the spread of opioids, it is about mending the basic fabric of our communities. It's about promising real help with true compassion and without judgment, to those in the grip of an addiction that is coiled around their spirit and their soul. And it's about confronting a deep and persistent challenge in order to chart a new course for our future and for the future of our country. And that's what everyone in this room has always done. Whether you practice, whether you're in law enforcement, whether you simply care. And more to the point, it is what our nation has always done. And it's what the Department of Justice, with your partnership, will continue to do. And as we gather here today, with so many individuals and organizations committed to this cause, I'm hopeful for what the future holds, because I'm thankful for your leadership, and I am confident that by continuing our partnership, staying true to our guiding ideals, we will succeed together in creating the stronger, the safer, the healthier communities that all of our children and that all Americans deserve. Thank you for your leadership. Thank you for your time. Thank you for your compassion. And thank you for caring about this important issue. And thank you for your time today. Have a wonderful conference.